Hello, wonderful viewers. Welcome back to the channel. Today we're talking about something that affects every single one of us: sleep. More specifically, how the way you sleep could be impacting your health, especially if you're over 60. If you've been waking up with aches, pains, or just not feeling rested, your sleeping position might be the culprit. The truth is, as we age, our bodies change. What worked for us in our 30s and 40s might not be serving us well anymore. In this video, I'm going to share 4 sleeping positions you should avoid after 60, and more importantly, for better alternatives that can help you wake up feeling refreshed, pain-free, and ready to enjoy your day. So grab a cup of tea, get comfortable, and let's dive in. Before we get into the specific positions, let's talk about why this matters more as we get older. After 60, our bodies go through natural changes. Spinal discs lose some of their cushioning. Our joints may become less flexible. Conditions like arthritis, osteoporosis, and circulation issues become more common. Even our muscles don't recover quite as quickly as they used to. All of this means that the pressure we put on our bodies during those 7 to 9 hours of sleep really matters. A poor sleeping position can lead to chronic back pain, neck stiffness, reduced circulation, acid reflux, breathing difficulties, and even increase your risk of developing pressure sores. But here's the good news. Making simple adjustments to how you sleep can dramatically improve your quality of life. You can reduce pain, improve your breathing, enhance circulation, and wake up feeling genuinely refreshed. Many of my viewers have told me that changing their sleeping position was life-changing. So let's start with what to avoid. The second position to avoid is sleeping flat on your back without proper support. Now, don't get me wrong. Back sleeping can actually be one of the best positions, but only when done correctly. Sleeping completely flat on your back with no pillow support under your knees is where the problem lies. When you lie flat without support, there's a gap between your lower back and the mattress. This forces your lumbar spine to work all night long to maintain that position, leading to muscle fatigue and pain. Many people wake up with that stiff, achy lower back feeling, and this is often the reason. For those with conditions like spinal stenosis, which becomes more common after 60, lying completely flat can actually worsen symptoms by narrowing the spinal canal even further. Additionally, flat back sleeping can aggravate acid reflux and heartburn. When your body is completely horizontal, stomach acid can more easily travel up into your esophagus. This is especially problematic for seniors who may already be taking medications that can affect digestion. Flat back sleeping can also contribute to snoring and sleep apnea. Without any elevation, your tongue and soft palate can collapse backward, partially blocking your airway. Sleep apnea is not just about snoring it. It's a serious condition that reduces oxygen to your brain and increases your risk of heart problems and stroke. The solution isn't to abandon back sleeping altogether. We just need to do it right, and I'll show you how in just a moment. The third position to avoid is side sleeping without proper alignment. Side sleeping is actually quite popular and can be beneficial, but many people do it incorrectly. The most common mistake is not supporting the space between your waist and the mattress, not properly positioning your legs. When you sleep on your side without support, your spine curves downward in the middle, almost like a hammock. Your hip and shoulder bear all your body weight, creating pressure points that can lead to joint pain and reduced circulation. This misalignment puts strain on your entire spine, from your neck down to your lower back. Over time, this can contribute to chronic pain and even accelerate joint degeneration. Many side sleepers also make the mistake of sleeping with their top leg dropping forward across their body. This twists the pelvis and lower spine, creating torque through your back that can lead to hip pain, sciatica, and lower back issues. For seniors with arthritis in the hips or shoulders, putting all that pressure on one side night after night can make symptoms significantly worse. 8. You might wake up with that joint feeling stiff, painful, and difficult to move. Another common issue is tucking your arms and hands under your pillow or body. This can compress nerves, leading to that pins and needles feeling or even more serious nerve issues over time. Carpal tunnel syndrome can be aggravated by poor arm positioning during sleep. Side sleeping can be excellent for your health at actually the best position for your brain waste removal system, but only when you do it with proper support and alignment. The fourth position to avoid is sleeping in a tight fetal position. Curling up in a ball might feel cozy and secure, but when you curl up too tightly, you create several problems for your aging body. First, it restricts your diaphragm and prevents deep, healthy breathing. When you're curled up tightly, your lungs can't fully expand, reducing oxygen intake throughout the night. This can leave you feeling tired and unrested even after a full night's sleep. Second, a tight fetal position puts significant strain on your back and neck. Your spine is compressed and curved in an unnatural C shape for hours. This can lead to chronic back pain and stiffness that's difficult to shake off in the morning. Third, this position can restrict circulation, particularly to your extremities. Have you ever woken up with numb hands or feet? Well, tight fetal positioning is often the cause. For seniors who may already have circulation issues or conditions like diabetes, this is particularly concerning. Additionally, curling up tightly can put extra pressure on your joints, especially your knees and hips. If you have arthritis or other joint conditions, waking up after hours in this position can make morning stiffness significantly worse. The tight fetal position can also contribute to jaw clenching and TMJ issues, as the position often involves tucking your chin down toward your chest. Now that we've covered what to avoid, let's talk about what you should be doing instead. These 4 alternatives can genuinely transform your sleep quality. The first recommended position is supported back sleeping, also known as the astronaut position. This is often considered the gold standard for sleep positioning, especially for seniors. Here's how to do it right. Lie on your back with a pillow under your head that keeps your neck in a neutral position. Your nose should align roughly with the center of your body, not tilted back or pushed too far forward. Here's the crucial part. Place a pillow or rolled towel under your knees. This slight elevation takes pressure off your lower back by helping maintain its natural curve. You should feel your lower back relax against the mattress rather than working to hold itself up. For added comfort, some people benefit from a small rolled towel placed under the curve of their lower back for extra lumbar support. The benefits of this position are numerous. It evenly distributes your weight across your body, reducing pressure points. Your spine maintains its natural curves. Your neck stays in neutral alignment, reducing strain. And importantly, this position is excellent for reducing acid reflux. Gravity helps keep stomach acid where it belongs. Supported back sleeping also minimizes pressure on your joints, which is particularly beneficial if you have arthritis or osteoporosis. It reduces facial wrinkles because your face isn't pressed against a pillow, and it can help reduce snoring and sleep apnea symptoms compared to completely flat back sleeping. If you have difficulty breathing or congestion, You can elevate your upper body by placing a wedge pillow under your entire torso. This should be a gradual incline, not just propping up your head with multiple pillows, which would bend your neck uncomfortably. This position takes some getting used to if you're not a natural back sleeper, but many people find that after just a few nights it becomes comfortable and they notice a real difference in how they feel in the morning. The second recommended position is properly supported side sleeping. Side sleeping, when done correctly, can be excellent for your health. It's particularly good for your brain, as this position allows your brain's waste removal system to work most efficiently. Here's how to optimize this position. Start by choosing your side. If you have heart conditions, many doctors recommend sleeping on your left side, as this takes pressure off your heart. However, both sides can work well. Place a pillow under your head that fills the space between your ear and shoulder. Your head should be level with your spine, not tilted up or sagging down. A contoured or memory foam pillow often works well for this. Now here's the key. Place a firm pillow between your knees and thighs. This keeps your hips and pelvis properly aligned and prevents your top leg from dropping forward and twisting your spine. The pillow should be thick enough that your knees don't touch. For extra support, you can hug a body pillow or place a small pillow against your chest. This supports your top arm and prevents your shoulder from collapsing forward. Make sure your bottom shoulder is positioned slightly forward, not directly underneath you where it would bear all your weight. Some people place a small towel under their waist to support the space between their hip and rib cage. The benefits of properly supported side sleeping include reduced pressure on your back, improved breathing, and reduced snoring, better circulation throughout your body, and excellent support for your spine's natural curves. This position is particularly beneficial if you have sleep apnea, as it keeps airways open. It's also good for reducing acid reflux and can help reduce swelling in your legs and feet by promoting better circulation. Many pregnant women are advised to sleep on their left side, and these principles apply to seniors as well. Proper side sleeping is gentle on your body while providing excellent support. The third recommended position is the reclined position. This might sound unconventional, but sleeping in a slightly reclined position can be transformative for many seniors, particularly those with specific health conditions. This position involves elevating your upper body by about 30 to 45 degrees. You can achieve this with an adjustable bed, a wedge pillow, or by safely propping up the head of your mattress. It's important that your entire torso is elevated, not just your head and neck. The reclined position is particularly beneficial if you suffer from acid reflux or GERD. The elevation works with gravity to keep stomach acid from traveling up into your esophagus. Many people find this completely eliminates nighttime heartburn. If you have breathing difficulties such as COPD, asthma, or heart failure, the reclined position can make breathing significantly easier. It reduces the work your heart has to do and allows your lungs to expand more fully. This position also helps reduce swelling in your legs and feet, which is common for seniors dealing with circulation issues or edema. The slight elevation improves venous return, helping fluid drain back toward your heart rather than pooling in your lower extremities. For those with sleep apnea or chronic snoring, the reclined position helps keep airways open and reduces the likelihood of your tongue and soft palate blocking airflow. Additionally, many people with chronic back pain find relief in this position, as it takes pressure off the lumbar spine while still supporting the body's natural alignment. When using the reclined position, make sure you have adequate support under your knees to prevent sliding down and to maintain comfort throughout the night. A pillow under your knees works well for this. Some people alternate between fully reclined and semi-reclined positioning depending on their symptoms on any given night. The flexibility to adjust is one of the benefits of this approach. The fourth recommended position is a modified side-lying position with elevation. This is an excellent hybrid approach that combines the benefits of side sleeping with the advantages of elevation. It's particularly helpful for seniors who want the brain health benefits of side sleeping but also deal with acid, reflux, or breathing issues. Here's how to set it up. Elevate the head of your bed or use a wedge pillow to create a gentle incline of about 20 to 30 degrees. Then position yourself on your left side using all the proper support techniques we discussed earlier. Pillow between your knees, proper head support, and a body pillow if helpful. This position offers multiple benefits simultaneously. The side-lying aspect promotes optimal brain waste clearance, which is important for cognitive health and may help reduce the risk of conditions like Alzheimer's disease. The left side positioning takes pressure off your heart and major blood vessels. The elevation helps prevent acid reflux while also making breathing easier if you have respiratory conditions. The combination reduces snoring and sleep apnea symptoms better than either position alone. This position also promotes good spinal alignment while reducing pressure on any one particular joint. The gentle incline can help with sinus drainage if you're dealing with allergies or congestion. Many people find this to be the most comfortable overall position because it addresses multiple concerns at once. It's especially popular among seniors who have several concurrent health issues that make sleep challenging. When using this position, make sure your entire torso is on an incline, not just your head propped up with multiple pillows. The slope should be gradual and comfortable. Your pillow should still support the space between your knees and keep your spine aligned. You can alternate sides if you find one hip or shoulder becoming uncomfortable. The left side sleeping is generally preferred for heart health and digestion. So there you have it for sleeping positions to avoid after 60, and for much better alternatives to try instead. Let me quickly recap. Avoid stomach sleeping, flat back sleeping without support, side sleeping without alignment, and the tight fetal position. Instead, try supported back sleeping, properly supported side sleeping, the reclined position, or modified side lying with elevation. Now, I want to be realistic with you. If you've been sleeping in a certain position for decades, changing it won't happen overnight. Your body has muscle memory, and you might find yourself rolling back into your old position while you sleep. That's completely normal. Here are some tips to help you adjust. Start with just 20 to 30 minutes in the new position before bed, reading or watching TV. This helps your body get used to the feeling. Use plenty of pillows strategically to prevent rolling into old positions. A body pillow can be particularly helpful for this. Be patient with yourself. It typically takes about 2 to 3 weeks for your body to adjust to a new sleeping position. During this transition, you might not sleep quite as well initially, but most people find that after the adjustment period, their sleep quality actually improves significantly. Consider investing in proper support tools, good pillows, a wedge pillow, or even an adjustable bed frame if your budget allows. These aren't luxuries, they're investments in your health and quality of life. If you have specific medical conditions like severe sleep apnea, chronic pain, or heart disease, definitely consult with your doctor about the best sleeping position for your situation. They may have additional recommendations based on your individual health needs. Keep a sleep journal for a couple of weeks. Note which position you used, how you felt in the morning, any pain or stiffness, and your overall sleep quality. This can help you identify which position works best for your body. Remember, good sleep is absolutely essential for healthy aging. It affects your cognitive function, your immune system, your mood, your pain levels, and your overall quality of life. Making these simple adjustments to your sleeping position can have a profound impact on how you feel every single day. I hope you found this information helpful. If you did, please give this video a thumbs up. It really helps the channel reach more people who could benefit from this information. Don't forget to subscribe and hit that notification bell so you never miss our videos about healthy aging and living your best life after 60. Drop a comment below and let me know. Which sleeping position are you going to try tonight? If you've already made changes to your sleeping position, I'd love to hear about your experience, what worked for you. Thank you so much for watching, and here's to better sleep and better health. I'll see you in the next video. Sleep well.